On this patient, they actually had an E. coli infection that was not visible on physical exam, was not revealed on their laboratory analysis, looking at their blood work. There was no really inclination of this. So this really bothered me. My sister's a breast cancer survivor, and had someone missed an infection on her, I'd be really pissed off.
One of the things that you do that I don't know of any plastic surgeons doing this is you do stool testing. You look at all the bacteria in the gut, the yeast, any kind of pathogens, parasitic activity, heavy metals even.
The heart program really helps you analyze it and know your specific genetic disposition, toxicity, gut microbiome, food sensitivity, and hormone balance. And then obviously that's a mouthful. But if you look at all of that, then you become more empowered to take control of the situation versus just throwing things up against the wall to see what sticks by going to a place or a provider who doesn't really understand the problem.
Hello and welcome everybody to Unreasonable Health. I'm your host, Regan Archibald, and today I've got Dr. Robert Whitfield with me. He's a medical doctor. He's been a plastic surgeon for 26 years, board certified for over 16 years. But the great thing about Rob, who I've been able to get to know since we met at the Da Vinci 50 conference last September, is he's somebody who thinks completely different than a plastic surgeon. Some of you may be saying, what are you doing having a plastic surgeon on the show, Regan? But many of you have had conversations with me about potential threats to your health, which are breast implants. And so I brought the world expert, Dr. Whitfield, on to talk about some of the things he's seen in his practice. We'll also talk about, he's a longevity expert as well. And so one of the things he does is this procedure called a no-cut facelift. So you're going to want to stick around and learn all of the protocols he does, because he's not interested in just operating on you. He's interested in transforming your entire life, because he helps you go through a systemic inflammation. He's got a detox specialist and a great team that can help you get your health to where you want it to go. So without further ado, Dr. Rob, welcome to the show.
Thank you for having me on, Regan. It's good to see you again. I feel like we spent a lot of time together in Austin since you're coming from Park City all the time.
Yeah, well, and we're trying to get you up here to Park City. So hopefully today we're going to just kind of spur that motivation just a little bit. But you got into breast implant illness. We'll just kind of dive into it. But how did you go from just being a plastic surgeon, I imagine doing implants and facelifts and all the typical things that plastic surgeons do? How did you get so focused on the healing aspect of the medicine that you practice?
Sure, it goes back to how I was trained. I had really just great mentors in surgery, and they were always very focused on us being very good clinicians versus developing surgical technique right off the bat. I give all the credit to them for my skills as a medical doctor, and then taking care of critically ill patients in burn units and ICUs and doing oncologic reconstruction. So my niche was always oncologic reconstruction. After I trained, I did microsurgical reconstruction for head and neck cancer, breast cancer, and sarcoma. And basically, I would see predominantly breast cancer patients because that's the most common form of cancer of those three that I mentioned. And I did microsurgery. So for your audience, I would take tissue with its artery and vein, so its blood supply is connected, and I would transpose that to different areas of the body to help reconstruct that from either tumor removal or trauma defect or a bad infection or something of that nature. And that was my practice. I did that for a very long period of time. And from time to time, basically because of that, I would have patients come in who had problems with their breast implant reconstruction. So the predominant form of reconstruction in the United States is still a breast implant for patients who've had cancer, because our country is so large, 330 million people. We're spread out all over the place. I worked in a very specific tertiary care environment. So for the audience, we would have complex cases shipped into where I worked. I didn't work in a community-based hospital where there's, a couple 100,000 people or even smaller. That alone led me to do a very specific type of procedure for cancer patients who needed that. So when I had somebody come in with a breast implant issue after radiation therapy or an infection or a capsular contracture where it got firm and hard and really affected the patient's quality of life, then I would get involved. And typically I would do what I did for those microsurgical cases where I'd take all the implant material out and its associated scar capsule that your body made, check it for cancer, check it for infection, and then I would do the reconstruction with the lower abdominal tissue, which we discard in a tummy tuck. But in this instance, we're maintaining the blood supply to it without disrupting the nervous supply or the rectus muscle itself. And so that was basically my program for that. And I would see people get better after that because obviously, if you're taking out a foreign body and using your own tissue, provided you have extremely high success rate, at that point, ours was over 95%, you'll have the result you anticipate, which, like for like known genetic material, there will be no rejection. There'll be no problems provided all the other aspects of the surgery went well.
Wow. Okay. And so as your mentor that, taught you how to be a clinician, and then you were actually doing it for, women who'd had to have tumors removed and things from their breasts, and that transformed into seeing when they would react to it. Now you're recognizing that fat transfer was a better solution.
Yeah, so taking a step forward in 2016, I had a patient who was not my oncologic patient, but sought me out just to take down her reconstruction, become flat, which is becoming, more common. Once again, as a plastic surgeon, you have to assess the problem, take the concepts that you understand, and provide the solution that the patient, will help them the most. And so I took down this reconstruction for this patient. And just like I said, I always checked for cancer and for infection because that was how I was trained by my mentors. And then on this patient, they actually had an E. coli infection that was not visible on physical exam, was not revealed on their laboratory analysis, looking at their blood work. There was no really inclination of this. So this really bothered me. My sister's a breast cancer survivor, and had someone missed an infection on her, I'd be really pissed off. So I kind of went back and tried to understand why I couldn't find this or I didn't find this. And what people need to understand is your body forms a scar around any implant. Knee implant, hip implant, breast implant, dental implant, doesn't really matter. Neural implants, they all get a reaction or a scarring type of phenomenon around it. And then that bacteria, if it's there, is locked in. Now, if you get an infection like a urinary tract infection, a respiratory infection, if you get a GI tract infection, skin infection, and that bacteria from that infection becomes bloodborne or gets in your bloodstream, then it can attach to that capsule and at that surface of that implant because that is foreign. And that's called hematogenous spread for the audience. That's the most common route that we see in surgical environments, where we did something, because it's uncommon at the time of surgery to contaminate something either from the people in the operating room giving you the implant, like the staff handing me an implant, or putting one in. So when I think about and I get asked, "Oh, Rob, why is this such a problem?" I'm like, well, the environment's the problem, right? It's not a great situation. So when I look at it, that's the most plausible, scenario in my mind. And I've done over 1,000 consecutive explants with PCR testing. So everybody remembers from the pandemic, there's antigen testing and PCR testing. PCR is accurate. So it's about 30% of the time that I find a biofilm, which is in this instance really a bacterial contaminant. The predominant species is Cutibacterium acnes, which is found on your face, chest, neck, and shoulders in really high concentrations. There's reports in the literature of this affecting shoulder implants, which are done by orthopedic surgeons. So it's really not hard to connect the dots for me. I mean, this is a very, it's a foreign body. And once again, when you're doing implant surgery for cancer or for trauma, and you're trying to make it so, if Regan injured his leg very badly, he could walk again in a trauma situation, or if I'm doing a cancer reconstruction, or if somebody's doing a head and neck reconstruction. I mean, these are all, these are quality of life and life-saving procedures that I was involved in when I was reconstructing patients from cancer. So there is a large, risk you take doing that for a patient. And that's, if there are other ways to do it, we would do it with a different product. That's why I did mostly the patient's own tissue for the breast reconstruction.
Got it. And I would imagine, if you start looking at where those infections are coming from, that would probably lead you to the next clue, which is looking at the gut, because one of the things that you do that I don't know of any plastic surgeons doing this is you do stool testing, you look at all the bacteria in the gut, the yeast, any kind of pathogens, parasitic activity, heavy metals, even. How did you go down that road? Was there an experience that you had that you?
Yeah, we were exposed to functional medicine, relatively early in my practice. Um, my wife initially, and then our daughter. Our daughters and myself are non-celiac, gluten sensitive. We don't
Yeah.
have the genetic capability to break down gluten. So for the audience, there's gluten on a whole, if you were in another country like Europe, typically wouldn't be bad. It's from ancestral grains, not the grain that's been genetically modified here in the United States. And so we get a lot of sensitivity to gluten and gliadin. So we had to learn this really early about my daughter because she was getting sick, but just by eating, you know, food. But I think we have to go back a step and say, like, what is food?
Oh, yeah.
Nothing processed, nothing out of a box. That's actually not food. Nothing that's frozen. That's got a ton of sugar and other preservatives in it. So, once we changed her diet and actually my son's diet, they became more and more healthy, and we've adopted that. We've been gluten free and dairy free in our house for a very long period of time. But that was through an interest I had personally in genetics from the time I was in college that I maintained. And then nutrition in terms of recovery is the key to recovery, whether it's a burn patient, cancer patient, trauma patient. Like those are fundamental principles and concepts that my mentors taught me in surgical training and then plastic surgery training that I've carried over and I've tried to expand. So my holistic accelerated recovery program for each of my patients includes genetic testing, toxicity testing, looking for heavy metals, mold toxins, and then any kind of environmental toxins like phthalates, glyphosates, mercaptopuric acid, xylene, all these different things that can really affect in my client's base is female, their endocrine system. So how their hormones are functioning. And then we look, like you mentioned, at stool testing because if your gut doesn't work, your brain doesn't work. The gut brain axis is a real thing. You get mood instability. And then we look at food sensitivities because you don't know what you don't know. So I basically have problems and limitations with sulfur metabolism, and I'm basically allergic to eggs, which I used to eat all the time, which I haven't eaten now in almost 2 years. And I, immediately, Reagan, it's funny, after I got my food sensitivity test back, I was like, man, I shouldn't eat eggs. So I just stopped eating eggs and I lost 12 pounds. This is all
It's funny
fluid
how that is. Yep.
around your gut because your gut has all this lymphatic tissue called GALT, gut associated lymphatic tissue. And so for the audience, like if you look like a man who's pregnant, that's not good. And that's how I was starting to look like that. And I
Mm.
stopped eating eggs because they all went away.
Well, I think we got about half of the men in America probably ought to do a food sensitivity test.
Oh,
It's a good start.
they're becoming more and more non-celiac gluten sensitive.
Yeah, it's everywhere. I mean, all the Roundup we spray on the wheat, along with the genetic modification, just makes it a double whammy. So, and I think this is fascinating. This is where you're so much different than most of the plastic surgeons out there. But I think the majority of clients that are going to listen to this are ones who they've had breast implants already. They're wondering, is this causing my thyroid to underperform? Is this causing this, this sleeplessness, this anxiety? But what are some of the symptoms that women specifically should look for if they have had implants?
Yeah, I get asked a lot. One, can I test for it? Well, there's no one test. I just gave you the complement of testing we do. And then two is, all right, what are the symptoms? So I feel like this is the confusion, Reagan. So if you're sitting in front of me and as a provider, you tell me you have brain fog, headache, light sensitivity, sound sensitivity, you can't swallow easily, you have difficulty swallowing, maybe
Yeah.
chronic cough, maybe you have chest pain, chest tightness, your arms hurt, you get nerve pain down your arms and legs, your gut doesn't work, it's swollen, you're bloated, you're constipated, you have diarrhea. Um, you know, the provider, if you're in that position, they just hit the panic button because they don't know what the heck is going on with somebody who otherwise maybe in their mid 30s, 40s shouldn't have all those problems. And so for the audience, look at it this way. If Regan steps out of his office and twists his ankle swells up. That's acute inflammation. Your body sends out effector cells, signals, if you will, to inflame that and then heal that. And then the signals will stop. Regan will begin to, walk again, and he'll be fine. With a chronic inflammatory process, which breast implant illness is, the signals don't stop. They just continue because the device is there. All these other things have now become problematic. Maybe they have mold exposure. Maybe they have an environmental toxin exposure. Maybe they have a heavy metal exposure. Maybe their gut is all off. As we discussed before coming on the show, I have a patient who's binging on lemon water and creating an imbalance. So for the audience, they should know this. I just did a show about it. You can find it on my breast implant illness show. If you drink a lot of lemon water, which is acidic, you'll actually kill some of the bacteria you don't want to in high enough numbers that you'll get not a bacterial overgrowth or a fungal overgrowth, you'll get a parasitic overgrowth. So if you're a premenopausal female who's having trouble with her periods, maybe the cycle's lasting too long and bleeding is more heavy, you'll become anemic and you'll never recover because the parasites will sequester your iron. Whether you eat it, drink it, it doesn't matter. The parasitic overgrowth will affect you. And I've seen this firsthand many times. I've had to transfuse patients with iron prior to surgery. But if you don't know that, you think you're doing the right thing. You're eating a clean diet, you're doing lemon water, or you're alkalizing, or you're taking probiotics like we talked about. Now, same thing with probiotics. If you don't know the gut microbiome you have, that probiotic may absolutely be the wrong thing to do. And so I just people like tap the brakes, just drink some filtered water, no probiotics, have some digestive enzymes, because all too well you're a high protein diet person as I am. If you don't have enough proteases to break down the protein, you'll ferment protein in your gut, and that'll make a new problem for you. So all these things are like, it's fragmented information that doesn't make sense all the time, and you just have to explain it in a way that really helps them.
Yeah. Well, and I think that's what's missing a lot of ways. So what you're saying is, some of those breast implant illness symptoms might look like gut issues. It might look like neurological issues, because the same thing, if you have difficulty swallowing, we see that in people who've had stroke or people who've had traumatic brain injuries. And so, but it's all related. And that's where these mycotoxins, and I guess, is the mycotoxins, is that the biggest threat of the breast implants?
I think, if you want to look at it critically, many of the breast implant illness patients have limited detox capabilities. So they have either problems with vitamin D synthesis or absorption, methylation, glutathione usage, antioxidant usage. So they really are struggling from a detox standpoint. And then as you go through life, you get more exposures, not less. The quality of food is going down, as is the air and the water quality. So when you don't know that, and you live in Austin, we'll say, I mean, there's tons of problems with mold in Austin. Or I get somebody from the coast. I'm like, Regan, I don't have to prove you have mold if you're from Hawaii, or if you're from California or Florida or Texas. You have to prove to me you don't have it, because I assume you do. And so when I hear you talking, you say, I get headache real easy, or I have light sensitivity or sound sensitivity. I mean, you have mold. It's not really complicated. That's neural inflammation. Most likely source in our patient population is a mold exposure. And then they're like, oh my God. And I tell them, like, did you live in a place with mold when you were in school or an apartment or your home? And you just they'll oh yeah, I saw mold. Oh yeah, I remember that. Like, that's the problem. If you have limited detox capability and repeated exposures, you just breathe that stuff in all the time. You can't really get rid of it. It's not that easy.
No. Well, and this is where genetic testing is so important. All the methylation pathways in the body are really important to support. If somebody does have breast implants right now, what are some things that they can do to make sure that they don't, if they want to keep them, because you and I are men, so we don't really understand the psychological benefits that come from having breasts. But what would be some things they could do to keep the breast as healthy as possible if they do have implants?
Yeah, that's why we created the program. The heart program really helps you analyze it and know your specific genetic disposition, toxicity, gut microbiome, food sensitivity, and hormone balance. And then, obviously that's a mouthful. But if you look at all of that, and then you become more empowered to take control of the situation versus just throwing things up against the wall to see what sticks by going to a place or a provider who doesn't really understand the problem. Like I see this problem, 30, 40, 50 times a week. And I've done over 4,000 consults for it and 1,800 explants. So it's not a difficult thing for us to analyze or discuss with the patients. I think you just have to empower the patient to understand what's going on with them, and then they can make an informed decision about how they want to proceed.
Got it. And so what's the big changes you've seen? I think I mentioned, and Tiffany Dancy's been on my show, and she's a big advocate for women who have breast implant illness and trying to create a lot of awareness around it.
Mhm.
What would you say, as far as the changes that women have seen in their lives when they've had the breast implants removed? What are some transformations you notice?
Once they've been removed and their inflammation goes down, I see, provided their genetics are in such a way that we can get them leveled up relatively quickly. Like if they have a really bad antioxidant pathway, it takes a little bit longer to get over fatigue, for instance. If they have a really bad mold exposure, it'll take longer to get them out of that situation. But say I just do it and somebody's got an implant based, biofilm low grade infection and we do the explant, they'll just go, exponentially, they'll get more energy, they'll feel better, they'll feel so good they start doing too much too quickly, and that can be a problem too in surgery. So that's about 30% of the patients in my history of taking care of this problem. And then that 2/3 boils down to what we've already discussed, which is what are their genetics like and their exposure history to toxicity, and how is their gut health? Because really, you know, if you can't absorb nutrition, as you know, then you can't really do much.
Yeah.
Everything will be limited. So if they have really poor gut health to begin with, it'll take them longer to recover. And it's very, you got to change your whole kind of thought process. It's a mindset shift about that in particular that people don't quite get. They're like, they think they're doing well, but in reality, when we show them the evidence, the proof is there. You just have to make the decision to change and adjust and go from there.
Yeah. Yeah, I think you bring up some really good points. And on the I want to shift gears a little bit because on your no cut facelift, I mean, first of all, what is that? I mean, how do you do a facelift with no cuts?
Yeah, so as we transitioned out of our breast implant illness population and started advancing more and more our interest in minimally invasive techniques for this discussion, I've had an interest in trying to do, you know, skin tightening and fat reduction without scarring. So it's kind of heresy for a plastic surgeon to say that, but Reagan, you would never come to me and say, "Hey, Rob, I need a facelift." That'd be the last thing you want me to do for you, right? Because it's visibly you're going to have scarring, especially as a male. We wear our hair shorter normally. My hair is either short or long. Today it's long, um, and that's really visible. Now, some people don't care. Others it really bothers. I personally don't like how I like to make incisions very well hidden, if at all possible. Uh,
Yep.
so I started using technology in 2017, which uses radio frequency a specific way to use energy and heat to tighten skin and reduce the fatty layer. So
Mm.
you can use it all over the body, but for the face specifically, we took microneedling. Everybody's probably heard of that at this point, but I was the first person in Austin to use what's called Morpheus 8 microneedling. So in 2018, we started using this product where it would deliver energy and heat to help stimulate collagen and elastin production, as well as something called face tight, which goes beneath the tissue. So you have a superficial treatment and you have a deeper treatment. And what you're trying to do is really stimulate enough inflammation to stimulate collagen formation and elastin formation, which is what we lose over time after age 35. The more you do that, the tighter the tissues become. So obviously it's easier to do in younger patients. So in anybody 35 plus, I'm always, encouraging skin tightening, whether it's my breast patient or facial aging patients. And so we did that for a long period of time. We were getting nice results. And then in Q1 of 22, an FDA approved device called Elicor became available. So that is, think of a microneedle, which is now solid and very small. The microneedle now is hollow and slightly bigger.
Mm.
So when it's hollow and connected to suction and I deploy it, I can now remove skin. And if it's small enough, 0.5 millimeters, it won't leave a scar. So now you can take skin out and not leave a scar. And so it was FDA approved for think of like our beard areas, so the lower third of the face. And of course, when I got it, I deployed it all over the body because that's how I am. I'm always going to figure out what it can do. And I've
Yeah.
done these procedures, my no cut procedures, I've done it on backs and butts and thighs and tummies and arms and necks and the face, the forehead. So basically, anytime you can remove skin without leaving a scar, that's like the grail. That's
Mm.
what I do. So when we combine all my other techniques with this, plus or minus peptides, plus or minus stem cells, which I can do in my office now, and these are all done under the local in the office. So if someone wants something to, because they're anxious, they can have an oral medication, of course. But I can numb a whole face, do a facelift. I can do my no cut facelift. I can do any of the above mentioned procedures. Um, and then, of course, what the audience probably, your audience doesn't know about my places. I have my own hyperbaric chamber in the office, and I have my own red light, and I have my own lymphatic masseuse. So we plug people into that right off the bat. So we want, higher oxygen delivery, nutrient delivery, stem cell delivery, peptide delivery, whatever we're using to help that patient as soon as we get done with that treatment. So, and we have other things called soft wave, which are ultrasound, non-invasive skin tightening treatments. So if I have it, we feel comfortable in our hands that it's going to give you a result, a change. And mostly what we're trying to change is what you've been losing over time, which is your collagen deposition. So everybody can eat collagen and drink collagen, as you know. Collagen's a huge molecule. You don't know what you're really absorbing. If anybody's been listening to this show, I think it's pretty obvious.
Right.
Your gut dictates everything, and it's really hard to say how much collagen you're getting out of any of those products. So what I do know is when I do microneedling or microcoring or my no cut facelift, I'm going to produce a lot of collagen from what I do for that patient in that moment.
Yeah. And as far as that, the skin, like you're using it on the stomach, the glutes, the legs, I mean, not just the face,
Right.
and you're pulling off little pieces of skin. What's the benefit in areas outside of the face?
Right. So like everybody, honestly, I get this a lot. They're like, Dr. Rob, I don't like how my knees look in my tennis skirt, I'm like, well,
Oh, yeah, yeah.
if let's all just think about how men and women, mature. Men usually mature later skeletally. They'll continue to growing, sometimes in their 20s even.
Yeah.
Women typically reach skeletal maturity by the time they're done with like eighth grade, we'll say. So I remember I think I was like 4'11" going into high school. I was like tiny. And and
Right.
someone like my wife, she grew to 5'10" by the time she was in eighth grade. And so you remember this. I was like
Oh,
looking up
yeah.
everybody, not just her, anybody. And that rapid growth really affects the hip area. So the hip thigh, if you look at many of my patients, they'll have stretch marks. And a stretch mark for the
Yeah.
audience is hair in the dermis. And there's never been a great tool to repair tears in the dermis. But if you bear with me, it'll make sense. So if you have 10 stretch marks over the hip area, that's why you get looseness below that towards your knee. It's not that you magically grew knee skin. It's because that area was affected by the rapid growth. And then that leads to laxity below the level at which that happened. So
Mm.
that's just to make it simple. So the way I treat it is you can do microneedling, like I discussed with Morpheus 8, that pokes little holes in it, that drives more collagen synthesis, and that produces a level of tightening. Now, when you do microcoring, like in our no cut procedures, that removes part of the stretch mark. So I'll be on a show later here in December. Many of your clients and listeners are familiar with Dave Asprey. I've did this a bunch to Dave Asprey's back and had an amazing change for him. with really very little in terms of downtime for it and no scarring that's visible. So like you can remove skin and tighten it, and if you follow, you can make the length and width of a stretch mark less, if that makes sense when you think about it, because I'm taking portions of it out. I'm not cutting it out. I'm just taking these little slivers out. So basically, about 26,000 skin sample removals, if you will, from this device will give you about 1.5 to 2 square inches of skin removal total.
Got it. Okay.
So it's
Well,
just math after that.
yeah, I'm so glad I asked because that makes a lot of sense. So if you look at everything you're doing right now, I mean, imagine if every plastic surgeon was doing what you're doing, it would make a huge change in people's lives. So, what's your next step? What is the next big innovation you're looking at bringing in? Or I know getting you up in Park City is a big goal of both of ours, but what new technologies are you excited about?
I really am super interested in expanding our genetic capability in terms of testing. So we're looking at pharmacodynamic testing all the time and developing a very specific age reversal testing package. That's mine. And then a breast implant illness genetic testing package, which is mine, that dictates how we'd perform their surgery from an anesthetic standpoint, because many people have trouble metabolizing drugs. So we're going to concentrate on that. And then we want to expand our stem cell offerings. We're looking into more options for that. We're going to expand our clinical staff with the addition of surgeons. And like we talked about locations, we want to get to Park City. That would be ideal, since I feel like we should have a shuttle between Park City and Austin as it is right now.
Yeah, yeah, you have a lot of clients that head over there to Austin, and that would be really exciting. So, and genetics is such a fascinating field. Now that we've been able to incorporate AI into some of the results, we're just like, it's just blowing my mind as far as what we can do with it. And I think that's brilliant. So let's talk about some of your favorite peptides, because my clients love peptides, and you and I love peptides too. But what are the ones you're noticing? I'd imagine like GHK copper and BPC and things like that. Any novel ones that you find just you get really good results in recovery?
Yeah, we felt really comfortable using PPC 157. That was our go-to. The thing that is problematic for our patients is, as anybody listening can tell, they're a pretty complicated group. So as I'm trying to change so many things at one time, I've kept the introduction of peptides to a very small portion of the program, because it's already such a complex program. So we had concentrated on BPC 157, and then after recovery, if they've had trouble with weight, if they've had trouble with residual problems with recovery, we have adjusted to some of the GLP-1 and worked on that in combination with BPC 157.
Got it. Okay. Yeah. The GLPs are really exciting. I know people, there's, as many people in the natural world that, they criticize the GLPs, but I've just found those to be such a dramatic breakthrough when it comes to rapid weight loss, people getting over their addictions. I mean, even the study where people on GLP-1s consume 77% less fast food. I mean, that's like, you can't argue with that. Like behavior change has come really quick on the GLPs. And so it's exciting.
Yeah, for the audience, if they're doing that as part of their program and have, we'll be discussing with problems with chronic inflammation, they want to see me, and discuss, their situation about an explant. We get them off the GLP-1 because, as you just highlighted, they may not be interested in eating now. So, for their nutrient absorption and caloric intake that I need, I put people on really high protein diets, just like you've discussed in your talks. I'm taking somebody who may weigh less than 150 pounds. I'm putting them on 150 grams of protein a day. So I'm really ramping that up in somebody who's probably never eaten like that in their entire life, because that would not make sense to them. Now, if they're not interested because they're taking a GLP-1, I tell them, like, okay, if we're gonna work together. You're going to run the program. You're going to come off of that. We'll run the program, do your surgery, and then given a period of time after recovery with or without detox based on their testing, then we'll reinstitute it under our, control and go from
Yeah, that makes sense. So how long do you usually wait, or does it depend on everybody's toxic burden before you decide when to get them back on the GLP?
Yeah, we've given them about 6 months normally because depending on how they show up, that's a fair amount of runway to deal with any additional issues after surgery.
Got it. Yeah. Have you noticed anything from GHK copper? Do you use it topically at all?
We haven't introduced JHK. I've been, I think I'm pretty conservative about how much I do at one time because it's hard in patients that are this complex to have a lot because you need the patient contributing a ton of feedback. And then we do a lot of fat transfers. And if we're using more topicals and get a skin reaction, like what's causing what? Is it a drug
Yeah.
reaction? Is it a topical reaction? So I try to keep that. I try to keep that under control because it's already a challenge. And I have a wonderful team like you have who takes care of the lion's share of this, the questions and things because I'm already, as you are, spread a little thin.
Hmm. Well, and it's so nice to have that, and I'm with you. When you have biology is always 1,000 times more complicated than we want it to be. I mean, everything you can have an explanation for things scientifically, but when you start putting inputs into the body, you never know what the output's going to be. And so, I get it on the simplification, especially when you're putting someone through a surgical procedure. There's a lot more variables that can be thrown into the mix there with the immune system being assaulted like that. So, well, this has been fascinating, Rob, and I really appreciate you taking the time. I know you're busy removing all those those implants, but how can people, first of all, get on Rob's show? So you've got two podcasts you do. One is the breast implant illness podcast. What's the name of your second podcast on longevity?
Yeah, it's Dr. Rob's Solutions. And if anybody wants to get more information about breast implant illness, you can go to breastimplantillnessexpert.com and take our quiz to see if that aligns with what you're experiencing. And then you can follow us simply on Instagram at Breast Implant Illness Expert. And we'll do videos and have discussions as well as breast implant illness on YouTube. So as it relates to age reversal, anti-aging, cosmetics in general, I discuss things, and we'll have Regan on and discuss peptides on that show for age reversal. That's the Dr. Rob's Solution podcast. And you can follow us on Dr. Robert Whitfield, at Dr. Robert Whitfield, I'm sorry. And then the URL is at drrobertwhitfield.com for those more generalized discussions.
Beautiful. Love it. And we'll post those links in the show notes. Final question for you. If there's one book people that you think would be beneficial for people to read, what book would that be?
Oh, wow. What did I just read? I'm really into financial literacy. I
Oh,
think
wow.
one of the most poorly understood concepts. And although it's not going to be everybody's cup of tea, Rich Dad, Poor Dad.
That's so good. Yeah. I read that book in like 2000 and it was so good. I love it. I didn't expect that. And but I did just speak at Garrett Gunderson's event. He wrote a new book called Money Unmasked. And I've had Garrett on the show several times. And have you read his new book, Money Unmasked?
I haven't, I keep reading these things. And it's like I need a whole nother, decade of just education. So I sit and every morning my jam is to listen to an audiobook and take notes on my remarkable tablet about what I don't know, which is quite a bit about financial literacy.
Isn't it crazy? Yeah, I'm the same way. My dad was a banker, and so I was always kind of like, nah, it's kind of boring number stuff. And now that I'm older, I'm like, oh yeah, he had some really damn good advice. Thank you, Dad. I've never had that much financial stress at all because of my dad. So, but didn't realize the principles that he taught me that were just subconsciously hardwired in.
Yeah, I got to leave one word for everybody. It's compounding.
Yeah. Isn't that Einstein, the eighth wonder of the world, right?
Compound.
Either if you don't understand what it means, then you're paying it. Yeah, yeah, something. He had something clever that he said. So yeah, love it. Well, this has been super exciting, and I think your book recommendation goes hand in hand because wealth and health are so intimately connected, and so yeah, it doesn't hurt anyone to get a little improvement in their financial literacy while you're thinking about some of the things that might really benefit your life. So if you enjoyed this show, if you know of somebody who would benefit from it, make sure you forward it to them, do them a solid. And Dr. Rob, can't wait to see you soon. We'll see you in Da Vinci 50 in Arizona. Will you be there actually?
No, because I'm going to do a live podcast with Ben Greenfield in May at the Da Vinci 50 in Sundance.
Oh, well, I'll see you here then. And I live 10 minutes from there. So let's hang out. Awesome. Thanks so much, Rob. And thanks everybody for listening to the show. We'll see you next week.